1. A caregiver designing a learning session for new staff should prioritize which principle of adult learning? A. Repetition without context. B. Experiential relevance. C. Passive memorization. D. Strict lecture delivery. 2. When evaluating caregiver training, the most valid assessment tool for hands-on skills is A. Multiple choice quiz. B. Peer feedback survey. C. Direct observation with checklist. D. True-false test. 3. Which curriculum development step ensures caregiver training aligns with organizational goals? A. Reviewing regulatory requirements. B. Writing post-training surveys. C. Distributing attendance sheets. D. Scheduling lunch breaks. 4. Effective caregiver communication with patients emphasizes A. Using technical jargon for precision. B. Active listening and empathy. C. Minimizing eye contact. D. Prioritizing speed over clarity. 5. Which is an example of formative evaluation in caregiver education? A. Annual certification exam. B. Mid-training skills practice assessment. C. Final written test. D. Post-program regulatory audit. 6. Mentoring a new caregiver requires the mentor to A. Impose rigid instructions. B. Encourage reflective practice. C. Avoid feedback to prevent bias. D. Limit learning to policy manuals. 7. Adult learners and caregiver training are most motivated when A. They memorize unrelated content. B. Learning connects to real-world caregiving scenarios. C. Lectures dominate without interaction. D. Assessments occur without preparation. 8. When developing caregiver curriculum, learning objectives must be A. Broad and abstract. B. Measurable and specific. C. Unstated to reduce pressure. D. Optional for learners. 9. Which communication strategy is best when explaining care plans to families? A. Overloading them with all medical details. B. Using simple, respectful, and clear language. C. Avoiding questions to save time. D. Speaking only to the patient. 10. A caregiver mentor can model professional behavior by A. Sharing personal frustrations openly. B. Demonstrating ethical and compassionate care. C. Ignoring workplace protocols. D. Delegating tasks without explanation. 11. Summative evaluation of caregiver training measures. A. Ongoing learner feedback. B. Immediate skill gaps during practice. C. Final competency after the program. D. General job satisfaction. 12. Which method best supports caregivers in retaining new skills? A. One-time lecture. B. Ongoing practice with feedback. C. Silent reading assignments. D. Avoiding hands-on exercises. 13. A caregiver trainer applying andragogy should A. Control all discussions. B. Recognize learner experiences as resources. C. Focus solely on memorization drills. D. Ignore learner input. 14. What is the main benefit of peer mentoring in caregiving? A. B. Increase competition. B. Shared experiential knowledge. C. Reduce collaboration. D. Limited communication. 15. When evaluating caregiver learning outcomes, validity ensures A. The test measures what it is supposed to measure. B. Learners enjoy the activity. C. All items are easy to answer. D. Questions are unrelated to objectives. 16. Curriculum planning for caregivers should first consider A. Lunch schedules. B. Learner needs and workplace requirements. C. Mentor availability only. D. Length of lecture slides. 17. Effective communication in caregiver teams prevents A. Duplication of work. B. Patient safety errors. C. Misunderstood responsibilities. D. All of the above. 18. A new caregiver struggles with a procedure. As a mentor, you should A. Criticize them publicly. B. Demonstrate and guide them step by step. C. Avoid helping to promote independence. D. Remove them from the task permanently. 19. Which type of assessment measures performance in real caregiving situations? A. Practical demonstration. B. Multiple choice test. C. Written essay. D. Group discussion. 20. In caregiver training, aligning curriculum with regulatory standards ensures A. Compliance and quality care. B. Reduced engagement. C. Excessive paperwork. D. Irrelevant content. 21. Adult learners prefer instruction that A. Is abstract and theory only. B. Applies to immediate job challenges. C. Excludes interaction. D. Relies solely on reading material. 22. Which evaluation method best tracks long-term caregiver performance? A. One-time test. B. Continuous performance appraisals. C. Informal chat with peers. D. Post-class survey. 23. A key role of a mentor in caregiving is to A. Provide emotional and professional support. B. Focus only on technical tasks. C. Enforce silence during learning. D. Avoid sharing personal experiences. 24. Which communication barrier most affects caregiver-patient interactions? A. Empathy. B. Active listening. C. Medical jargon. D. Clear instructions. 25. The primary purpose of caregiver training evaluation is to A. Verify lunch breaks were scheduled. B. Ensure learning objectives were achieved. C. Entertain participants. D. Satisfy budget requirements. 26. In adult learning, intrinsic motivation is enhanced by A. Practical application. B. Memorization drills. C. Passive note-taking. D. Punitive grading. 27. A well-designed caregiver curriculum must A. Exclude feedback opportunities. B. Be learner-centered and outcomes-based. C. Avoid measurable objectives. D. Use random content. 28. What is the mentor's best approach when a caregiver is hesitant to ask questions? A. Create a supportive, non-judgmental environment. B. Ignore their silence. C. Criticize their lack of confidence. D. Withhold information. 29. Which evaluation tool measures knowledge retention? A. Post-training quiz. B. Attendance sheet. C. Peer mentorship session. D. Informal conversation. 30. The most important principle of caregiver-patient communication is A. Confidentiality and respect. B. Technical accuracy only. C. Using complex terms. D. Limited interaction. 31. Which adult learning strategy works best in caregiver education? A. Case studies and role play. B. Memorization drills. C. Silent lectures. D. Avoiding learner input. 32. When developing a caregiver curriculum, the first step is A. Needs assessment. B. Creating test items. C. Writing attendance sheets. D. Selecting classroom. 33. Which type of feedback is most effective in mentoring? A. Timely, constructive, and specific. B. Delayed and vague. C. Harsh and judgmental. D. Avoiding feedback entirely. 34. A summative evaluation at the end of caregiver training is most useful for A. Measuring final competence. B. Identifying ongoing learning needs. C. Supporting real-time corrections. D. Providing casual discussion. 35. Which regulatory requirement often guides caregiver training content? A. State or national health standards. B. Learner preference surveys only. C. Personal mentor interests. D. Random workplace policies. 36. In caregiver communication, cultural competence ensures A. Respect for diverse backgrounds. B. Avoiding patient preferences. C. Standardized communication only. D. Ignoring language differences. 37. Which best demonstrates a caregiver's ability to transfer learning into practice? A. Performing tasks safely in real situations. B. Completing a written multiple-choice test. C. Passing an attendance requirement. D. Listening to a lecture. 38. In adult learning, feedback during practice sessions should A. Reinforce correct behaviors. B. Be delayed until program completion. C. Focus only on errors. D. Be optional. 39. Which mentoring style builds confidence in caregivers? A. Coaching with encouragement. B. Criticism and strict control. C. Withholding support. D. Indifference. 40. When evaluating caregiver education, reliability means it. A. Results are consistent across assessments. B. Learners enjoy the activity. C. Scores vary randomly. D. Tests measure irrelevant factors. 41. Which method best ensures caregivers internalize ethical standards in practice? A. Role modeling and reflective discussion. B. One-time written policy review. C. Memorizing regulations without application. D. Ignoring ethical dilemmas. 42. A comprehensive caregiver curriculum should include A. Only technical skills training. B. Communication, ethics, and patient safety modules. C. Attendance policies as the focus. D. Personal anecdotes without structure. 43. Which strategy best helps evaluate caregivers' ability to apply new knowledge? A. Simulation exercises with debriefing. B. End of training satisfaction survey. C. Attendance confirmation. D. Reading assignments. 44. A mentor promoting lifelong learning in caregivers should A. Encourage continuous self-assessment and development. B. Limit training to mandatory sessions only. C. Avoid sharing learning resources. D. Discourage further education.